Hi, I'm Loren, President, CEO of Silverado, and I'm here with Kim Butrum, our Senior Vice President of Health Services. And I want to talk to you today about the actions Silverado has taken. Since the beginning in COVID, we've taken bold steps to keep our residents, our patients, our families, and our associates as safe as possible. And along those lines, we were having challenges just like everyone else to find adequate PPE. Nonetheless, we went out, put together the resources in this home office, and we found it. And we've delivered PPE for our staff ever since day one, and we continue, and we will continue all the way through. But Kim, as a nurse, what's it mean to you to have PPE?
I think it's been huge because so much in caring for someone with a dementia has to do with how to gently redirect, how to touch them. You can't care for someone socially distanced 6 to 9 feet away. And so to allow that, we've invested in those medical grade KN95 masks, and everyone in our community is masked with that level of a medical grade mask.
Even housekeeping and laundry and
face shields if they're
culinary?
having Oh. And that is a huge differentiator, because if you weren't, you'd be trying to keep people away, keep them in their room, other things like that. That's not our model of care. We have to be hands-on, loving. We want life to continue, and that adequate PPE and really that investment has been able to allow us. And I just want to share, we've actually looked at our outcomes once we put in place the use of those KN95 masks consistently, and we have had multiple now it's been all of our communities have had at least one associate who has not had symptoms but tested positive, because we are doing regular testing of our associates. And in those communities, we had absolutely no community transmission to any resident. That speaks volumes to our staff, our leaders following protocols and the use of those medical grade masks.
That's huge. That's really huge. And I know you've got data compared to the national experiences, and we far exceed what is happening nationally. And let's talk about family visitation. It's really important for families to visit. And I know masks probably play a role here too. But what are the protocols? What do you think about as a professional clinician, keeping people safe and accommodating the importance? I know you know the importance of families visiting, to the families and the residents.
Well, Loren, we all talk about isolation as being that people underplay don't realize what isolation and can do in someone living with a memory impairing disease, or even just being older. It's been shown that actually it can worsen dementia. And so trying to deal with a pandemic, you've got to do everything you can, and we are committed as a company to do everything we can to make sure that our residents don't feel isolated at all. And that means loving them ourselves. That means facilitating whatever is needed for those family visits. In some areas, it may be a window visit, and we make sure we use our Eversound so that mic can go right on from what the family member is saying to those residents' ears, so they can hear what is being said. In other locales, we can do outside visits, and we will accommodate to the maximum to allow our family members to see their loved ones, and our loved ones to see their family members. That is a big piece of what we do.
I know in some locations we've even gone into in-community visits in our community, and special room and that sort of thing. And end of life, where people are their loved one is with us typically to the end of life. Really important those last few days to be able to visit. Do we accommodate that?
Absolutely. We have the flexibility to do that, and we are doing that frequently. And I will share that there are ways, and with the use of the masks we're using and the appropriate PPE, that to make these visits safe. And it is exciting now that we've moved to being able to do some indoor visits, and we will continue to push the envelope on being able to do that for our residents.
Yeah, well, it's really so many moving parts. Thank you. Really appreciate your time, and thank you all.